Hello, my name's Louise Jones. I'm Professor of Breast Pathology and I work both at the Barts Cancer Institute at the Queen Mary University of London and Barts NHS Trust. And I'm going to talk to you about some of the key testing that we do in breast cancer. And like most cancers, breast cancer is not a single type of cancer. And one of the ways in which we characterize different kinds of breast cancer is looking at the expression of hormone receptors, such as estrogen receptor and progesterone receptor, and the growth factor receptor HER2. And what you see here on this slide is that approximately 70% of breast cancers overexpress estrogen receptor. And in the next slide, you will see why this is important. Next slide, please. So when estrogen receptor binds its ligand, estrogen, it activates downstream signaling pathways. And these pathways activate tumor cell proliferation. They drive tumor cell growth. And so we routinely look for the expression of estrogen receptor using immunohistochemistry. And when there is an ER positive breast cancer, as you see in the central panel, we know that we have powerful drugs that can prevent that interaction between estrogen receptor and its ligand, and it halts tumor cell proliferation, which is fantastic. But next slide shows the downside. Because cancers evolve, they outwit drugs. And we know that over the period of treatment of patients, that many who are on anti-hormone therapy will become resistant and their cancer start to grow again. And now we understand that up to 50% of this resistance that we're seeing is because the estrogen receptor has developed mutations. And it develops mutations in the ligand binding domain. And what I mean by that is that the estrogen receptor doesn't need estrogen anymore to signal. It just signals. And so the tumor starts to grow again. And just last year, a new drug was approved and it degrades the mutated estrogen receptor. And we can detect that estrogen receptor mutation in circulating tumor DNA. So we just need a blood test and we do next generation sequencing, and then we can identify these patients and treat them. Another very key development in breast cancer was the discovery of HER2. HER2 is a transmembrane growth factor that activates, if you will see, the similar downstream signaling pathways that promote tumor cell growth. And, it's the holy grail because it's very rarely expressed on normal tissue, but it's highly expressed on about 15% of breast cancers. And we analyze this using immunohistochemistry, but also, as you see in the right-hand panel, using fluorescence in situ hybridization. And what we're looking for there is the number of copies of the gene, because HER2 is overexpressed because it's amplified. There are just multiple copies. There should only be two. And so there's loads of this on the cell membrane, and it's driving this growth. So the next slide is shows why this is such an important discovery. Not expressed very highly on normal tissue, highly expressed and driving the growth of a subset of breast cancers. And so humanized monoclonal antibodies were developed and they changed the outcome, the behavior of a highly aggressive cancer into something much better behaved, if you like, with a much better survival. But because we know that tumors will become resistant, there is continued effort, as you see on this diagram, to create further targeted drugs that will overcome resistance. And I think I want to finish here by just saying that, with the advance in our molecular analysis of tumors, all tumors, including breast, the discoveries in the lab are translating into new tests, and it's very dynamic and it's very exciting. Thank you. I'll finish there.